Hi, everyone. This is Laura Pegram over here at NASDAQ. I'm the Associate Director of Drug User Health over here, and I have the pleasure of helping some community partners host this webinar here today on increasing access to mail-based and online harm reduction services. People are still filtering in, so we're going to give just a couple minutes to let that happen so that people can get the whole show today, but really excited to have this to help be hosting this webinar and to have our friends over at NextDistro and our special guest Corey Davis from the Network for Public Health Law go over their efforts for both Naloxone and NextDistro and really thinking and really really just wanting to appreciate at the outset all of their efforts on this because we know, well, really for forever, but especially in light of COVID, increasing access and opportunities to access harm reduction services, especially those that are distance-based or virtual, are just incredibly, incredibly important at this point. So really just so grateful. Just a little bit of housekeeping here so that we can eat up a couple minutes while people are filtering in. This is not a Zoom-based platform. It's a GoToWebinar platform. For folks who are listening in, you are actually unable to speak. So if you want to ask questions throughout this, the best way to do that is either in the questions box, which should be on the little docket, or there's also a chat box. We are going to hold the majority of questions until the end, unless there is something that is very urgent and timely, but myself and some of our support staff over here will be monitoring that pretty closely. And just so everyone knows, we are recording this and it will be available both on the NASDAQ website and I believe eventually on probably a link towards for the next site as well. So excited to help do that and make this available for folks who couldn't attend today. I don't think that we are missing much of anything else, and I want us to keep on time. So I am going to go ahead and pass it over to the next team to take it away and tell us all about the really amazing, innovative work you all do that, again, so appreciated in the space. Jamie, are you going to start us off?
Yes. Hi, everyone. My name is Jamie Favero. I'm the founder and the executive director of Next Harm Reduction, also known as NextDistro. We're located online at nextdistro.org. I want to start the webinar with the acknowledgement that mailing supplies, mailing naloxone and harm reduction supplies has been a mainstay for people who inject drugs and harm reductionists for many, many years. And also recognize the inspiration that Tracy Helton from the Bay Area gave to this project. I've been working in needle exchange since 2001, and I heard Tracy speak at a conference at the Harm Reduction Coalition, the Harm Reduction Coalition conference, and she was talking about mailing naloxone to people in rural areas that she had met on Reddit recovery forums. And folks were overdosing because they couldn't access naloxone, and EMTs were taking so long to respond to 911 calls. So she was mailing people naloxone, and I feel like a light bulb went off in my head. Why aren't we bringing harm reduction and syringe access to scale nationally using an online and mail-based platform? Basically, what would a needle exchange look like if it utilized technology to offer the education, the resources, the supplies, and the support that anyone would access if they walked into a harm reduction program? We're here to share our histories, our experience, and our values with you, and we use these to inform our practice. We were founded in 2017, and we began mailing in early 2018. So I'm based in New York State, and originally Next was founded to be a New York State syringe exchange program. And when we launched, we actually started getting requests from across the country, not really from New York as much as from a lot of southern states and middle states where folks had a real difficult had a lot of difficulty accessing harm reduction supplies. So that was kind of the first thing that was notable about Next. We also were receiving a lot of requests for naloxone. People who were not injection drug users, they were friends and family, they couldn't access Narcan or naloxone due to cost, distance, or stigma. Perhaps they lived in a small town and didn't want to go into the pharmacy where they knew everyone to get naloxone. So the project for a while branched out into two sections: Next Distro, the online full service harm reduction program, and also Next Naloxone. And we've had a lot of success with Next Naloxone. When we launched it in November of 2018, we quickly began getting requests from across the country, and that helped us create a hub and spoke model, which we operate under today. And this means that we kind of transitioned from being a direct service organization, which we still very much are, to an organization that is fundamentally rooted in supporting other organizations in other states to adopt this innovative model to support people who use drugs across their state, specifically in rural and hard to reach areas and populations that are not accessing in-person service. So right now we operate in 34 states through our Naloxone Partnership, and we're really excited to partner with additional health departments and harm reduction organizations in states where we don't operate. A map of where we are can be found at nextdistro.org/naloxone. At the bottom of that page, there's a map. And also on our team page, there's a current, we have all of our affiliates up there as well. So the goal of Next is really to consolidate the collective wisdom of the harm reduction community. So we want to acknowledge that people all across the United States use drugs differently, talk about drugs differently, the types of drugs they use are different. And what does that mean as we're building an online and mail-based model to act as a hub of resources and support for people across the country? And really what we're trying to do is partner with pre-existing programs in states to connect individuals who use drugs to organizations within those states. So for example, in California, we're partnered with HEPAC, where Sean, who will be coming on later, is the California State Director. And what that means is folks from California use nextdistro.org to enroll and order supplies, and they're connected directly with Sean. So when folks need information about medical support, HIV or hepatitis C testing, buprenorphine, they're able to connect with someone in their state that is very familiar with the resources available to them. It's never Next's intention to take people out of in-person service. We always want to support and uplift in-person syringe exchange and harm reduction programs. So for example, if someone attempts to enroll in Next and they're from an area where there's a pre-existing harm reduction program, we always refer out. And that may mean that we call the harm reduction, if we're not familiar with them, we call them, we ask about the specific hours and folks to speak with, and that way we're able to provide a really warm handoff for folks to connect to harm reduction programs in their own area. This organization, this model is really for folks that can't access harm reduction program, because mostly for geographic reasons. I do also want to acknowledge that mail-based harm reduction is really a second best model. As someone who's worked in direct service for a number of years, it is often very heartbreaking to not be able to look at people in the eye and to give them hugs. I know with COVID that's not possible anyway, but we're able to use like phone calls and texts and emails and all of the technology that we have available to us, but it is a second best option because we are really not able to connect with someone one-on-one physically, which is difficult. So I'm excited about your questions and this webinar and expanding this model further nationally to support people who inject drugs. Thanks.
Thank you, Jamie, for the great overview of the program and kind of introducing what we're all about. My name is Dan Coelho. I'm the program coordinator, and I kind of oversee the day-to-day operations, and I kind of want to go a little bit more in depth about what Jamie was talking about, as well as the structure of the organization. So as Jamie mentioned, Next is split into two main branches. We have the Naloxone program, which was previously called Next Naloxone and is now merged into one website, with our distro branch, which is our primary harm reduction supply and mail-in program. The Naloxone program, we're currently operating in 34 states, and using that hub and spoke model, we've been able to partner with different affiliates in each of these 34 states that we operate in. To use an example, we are partnered with Harm Reduction Ohio in Ohio, and they've been a partner that has worked closely with us and increased the amount of requests for naloxone coming through tremendously. As part of the program, each affiliate can design, with our help, a web page on our website that lists out all the resources that they're big fans of in the state, as well as provide infrastructure for requesting naloxone. We're kind of designed our back end to be fully customizable, so programs can choose what kinds of videos they want to show, and any information that they want to present, along with the training video for naloxone. So we're definitely focused on providing the program the tools that they might need to help request naloxone online. Now, in terms of the distro program, the flow starts with first the user discovering the Next distro program online, and then, as Jamie mentioned, we go through and we collect demographic information as well as other data points from them, and we can help enroll them into our program if there isn't a syringe exchange program nearby. Now, Laura, can you bring up the next slide, please? So this is a map of our activity across the United States to date. Now, as you can see, we've covered roughly 50% of the counties in the United States, and this map represents any kind of interaction that we have with the participant. So that could be sending naloxone, referring them out to an in-person program, or us sending supplies directly. For the remainder of my section, I'm going to use California as an example state. So we're partnered with currently with HEPAC to distribute supplies in California. Sean is our state director, and you'll be hearing from Sean in a little bit. But this has been a really great partnership, and we've been able to do a lot of work mailing supplies in California to folks who are underserved. Laura, could you hit the next slide, please? Thanks. So I want to go over a little bit about our growth over time and distribution. So this is the amount of naloxone requests that we've filled through January 31st, 2021. As you can see, it's been a stable upward trends in growth. We're roughly at 20,000 or so requests for naloxone that we've filled, all thanks to our great affiliates, and we're also mail out ourselves from New York. Could you go to the next slide, please? And in terms of the distro program in California, this is the enrollment since we started the program formally in June. Again, you can see kind of an upward rise in enrollments, and Sean can talk a little bit more about that later. Next slide, please. And these are some hard numbers on the supplies that we've distributed. So on the left, you can see the naloxone doses that we've distributed by month through January 31st, 2021 through the California distro program. And on the right, our total syringes distributed. I believe the numbers are, we've distributed 2,500 doses of naloxone of both formulations through our program in California, and close to 92,000 syringes through our mailing program in California. So again, you can just see the curves. Everything has just been upward growth, and we've seen a lot of interest from folks who are in isolated areas and don't have access to resources requesting through our site. Next slide, please. Now I kind of want to go through some of the demographics. As Jamie mentioned, the populations that we serve, we're always focused on highlighting BIPOC and underserved populations, always making sure that we're aware of the populations that are isolated and need help. So this is the breakdown for both arms of the program by race and ethnicity. As you can see, a lot of the people requesting on both arms of the program are white. but we are, we're actively working to make sure that we are being representative and reaching populations that are traditionally underserved in our work. Next slide. I also want to point out that Next has done a great job reaching like female populations and populations that are part of the LGBTQIA community and just don't identify in the traditional binary system. I recently learned in New York that the traditional kind of breakdown for in-person service programs leans heavily male. In California, you can see that it's way closer to a 50-50 split, and then on our Naloxone program, it's actually very female heavy. And so this kind of presents an opportunity to reach, again, populations that are not being served by our current system, or otherwise don't have access to resources in their own local community. Next slide, please. And again, with age group, we also want to point out that we're able to reach young people, which again is a population that hasn't traditionally been served by brick and mortar syringe exchanges and any local resources that are available in the area. So we can leave this up in it for a second just to look at it. But this is the general breakdown of the age groups that we see. On the left is from our Naloxone program, and on the right is from the California program, the by mail harm reduction supplies specifically. And I also want to bring up the fact that of the people requesting supplies through the mailing program, 37% do not have or are unsure if they have health insurance. So again, we're, over a third of our participants, they're not receiving care through traditional care models. 64% of them don't have a primary care physician. So again, these are groups and populations that we're able to tap into and provide some level of support that aren't in active, have active relationships with healthcare and are likely using emergency medical care as their primary form of healthcare. And then I just want to transition off to Sean, who can talk a little bit more about the California program.
Awesome, thanks, Dan. So I'm Sean Salas. I'm the California State Director for the partnership between Next Harm Reduction and our local organization, HEPAC. We're located out of Oakland, California in the San Francisco Bay Area. I'm here to talk a little bit about what it's like to be an affiliate with Next, some implementation, outreach, and other considerations from an affiliate perspective. So in California, we have a two-person team. There's myself as the state director, responsible for expansion of the program statewide, partnership building, outreach, marketing, linkage to services and programming for participants, as well as participant communications, or a big bulk of participant communications. We also have our program associate, Dio, who's responsible for logistics of inventory, packing, and shipping of supplies. And then, of course, we're supported on the back end by the rest of the Next team. And something I want to emphasize, sort of as like a really strong quality of the partnership model between Next and a local organization, is that the partnership allows for us to sort of reach toward the full robust nature of an in-person syringe exchange program. As Jamie mentioned, it's sort of a second best option, but we always try to reach toward replicating everything an in-service or an in-person program offers, but statewide through technology in the mail. So, Next provides the infrastructure and the back-end technology to implement the program, and then by being locally embedded in the state through a partnering org and being connected locally and regionally and rooted in our state's unique nuances and needs, it allows us to facilitate both like a culturally specific and state targeted programming, as well as our linkage work to medication-assisted treatment, mental health services, testing, etc. So a really meaningful cornerstone of the Next programming and how we've been able to be successful really involves, I think, the meaningful engagement of our participants across distance. So that looks like, our ability to build rapport with communities and individuals has really contributed to rapid growth across California. We build trust both through like our linkage and our warm handoffs to other programs, our communications being available by phone, text, email, and being really readily available, accessible, warm, friendly, etc. As well as through like the personalization of the experience and the packages that are received. So, nothing about our process is automated. Every package is customized, custom ordered, and includes a handwritten note with specifically selected resources based on questions asked during the enrollment and ordering process. And I sort of see that as us holding a conversational space to address the unique issues brought up, both in an educational way and also just in kind and compassionate responses. We have folks who will mention in their order form that they reversed 7 overdoses last week, and that's something we would certainly highlight and talk about in the note and engage the participant through. And through this, we've been able to really establish ourselves as a trusted program in particular communities and regions. So we've been able to engage whole networks of people who use drugs through initially engaging with just single participants. We do get referrals from a variety of sources, established SSPs, social service organizations, hospital MAP programs, as well as, online through Google, or as Jamie mentioned, online forums where people who use drugs hang out online. But our primary referral source and how you sort of see those large spikes in enrollment is through word of mouth. So we do have sort of like a snowball effect, particularly in hotspot areas throughout the state that show great statewide need. So we've seen a really big reach in certain rural and underserved suburban areas. Sort of as soon as a single participant is identified in a region, enrollment just spreads rapidly. That means there's lots of developing opportunities to uplift and call upon networks of people who use drugs to support broader distribution. So, that can mean everything from just engaging individuals like, hey, I'm going to send you 5 extra enrollment brochures for those folks that you mentioned who maybe, want support, or like more robust programming around peer support, opportunities to support folks who are already serving as peer educators or peer leaders or peer distributors on how to best support their communities. So, what this in general is highlighting is just a great statewide and national need to increase harm reduction services and access to programs, particularly in rural areas. With that, we need to make some considerations around determining and managing overall program capacity, output, and budgets in intersection with participant eligibility. So as we saw sort of in the data that Dan showed, when the program takes off in certain areas, it can happen in culturally isolated ways. So we might see a spike in enrollments, but with really homogeneous demographics. So to mediate this, sort of in addition to targeted marketing and partnership building in specific communities, we want to orient our strategies around equity and access by integrating complex enrollment criteria and metrics. So, considering who our priority populations are due to heightened overdose or disease transmission rates, considering HIV and Hep C status, considering proximity to programs and access to supplies and access to transportation, as well as, the likelihood of sharing or reusing supplies, all things to consider when determining participant eligibility. So lastly, I know a topic many of you all who registered were interested in was around the accessibility of the program for folks who are experiencing homelessness or who may have low technology access. So that's been a high priority of mine in California. So in addition to the we try to keep it as low barrier as possible, the online enrollment and ordering, just keep it as simple as we can. We also offer paper enrollment guides and a phone line open for phone-based enrollment and ordering. So trying to just make really the only necessary requirement for enrollment and ordering being access to anyone's phone and access to getting a hold of us. And as far as shipping, we do ship to pretty much any address a person can receive mail, whether that be a friend or a family. There's a few folks who receive packages shipped to social service agencies where they're allowed to receive mail, as well as to general delivery, which is a great service where folks can receive packages sent to their local post office and pick up, and that's worked for a number of our participants who are experiencing housing instability or homelessness. There's definitely room for growth around increasing access, particularly in communities with unstable housing, which is something I'm always interested in expanding. But overall, we've seen really success in growth in California, and it's been fantastic collaborating in partnership with Next. It's really just highlighted the overall need for unique solutions to address the need for harm reduction services statewide and nationally. So that's it for me for now. I believe we're sending it back to Dan at this point. If I'm correct. Nope. Yes, back to Dan. Okay, great. Thanks so much.
No, thanks for the overview of the California program. Laura, if you could bring up the slides again. I had the next one I wanted to show. So I just wanted to acknowledge also our capacity for providing secondary distributors supplies. We feel that this is definitely one of the strengths of our program, is being able to reach people who are isolated or otherwise, again, don't have access to anything in their local community. So as you can see, most of the people requesting through our program are not just getting supplies for themselves, they're also getting supplies for other people. You can see the category I am getting supplies for 1 to 4 people makes up the plurality of our client base. So that's around household size. The next largest group is 4 to 10 people. So that could include neighbors and just, a small network of people who know each other. And then even I was surprised by this, around 13% of people are distributing to 11 or more people within their network. So the potential to reach communities that have no resources, or even in an area where there's no non-judgmental resources available, is great through this program until in-person access becomes available, or other alternatives are available. So you can take down this slide now, Laura. I'm going to talk a little bit now about our values in security and privacy. So we hold security and privacy at Next in extremely high regard. That's our top priority when enrolling someone, is making sure that they feel secure and safe, and that all their communications with us are private. So to that end, we do everything we can to ensure the security of our participants, and that's an extremely important aspect of our program. So our primary forms of communication with anyone who enrolls are Signal and Protonmail. For those of you who are not familiar, Signal is an end-to-end encrypted messenger that runs on mobile platforms. So through your smartphone, available for, I believe, every platform. It's Android and iOS. And Protonmail is one that's available universally, that operates on computers. That's just an email client. Again, that's end-to-end encrypted. We prefer Signal because we will always know that it's encrypted no matter what. Protonmail is a good second option for communicating with people. So that will store all communications on their server securely and encrypted. But again, the weak link there is with any participants who might be using Gmail or an unsecured email client. Again, that's unavoidable. And because we try to be low barrier, we don't have any requirements for communication. We prefer those too, but we want to acknowledge the fact that the people that we're serving may not have access necessarily to smartphones, to stable internet, to something that they could use to communicate securely. So we also do communicate via text, over phone, but we prefer to kind of maintain that hierarchy of security when possible. When someone has actually become enrolled in our program and is communicating with us regularly and is receiving supplies, we do use a handle system, as we call it, to anonymize any information. So when we are communicating and when people are first asked to enroll and provide information, we ask them to create a handle or a username, and this is how they order supplies on our order form online. So this handle, it's unique, it's tied to each individual, and it doesn't reveal any name or other identifying piece of information when they are placing an order with us. And I want to talk also a little bit about the enrollment system more specifically. When we are taking in information from clients, again, we're always making sure that it's as secure as possible using the methods that we have available. We always decouple any demographic information that we collect from their name and their mailing information and any personally identifiable or traceable information. So what I mean by that is when someone enrolls, they first go through the enrollment application process, submitting all the answers to our demographics questions and things like drug use history, any other information that we collect to help us better serve them. But that is not, they do not submit their name or their mailing address or anything like that with that information. That is submitted via a separate channel. They then separately submit it through either Signal or Protonmail, their name, their handle, so that we can match their application with the information they received, and their mailing address separately. To use a hypothetical scenario, if one of those things is compromised, the other is not accessible, both kinds of systems would have to be accessed or broken into to be able to then combine that information. And this protects the security of people who are in the middle of enrolling or did not fully enroll in the program. So we, as you can see, we take it very seriously, and it can kind of be a hassle sometimes, but it's our priority, that we keep everyone's information safe. So that's kind of an overview of our security systems here at Next. Also, we're big fans of two-factor authentication. I have to throw that in because that's so important. We require that across all our accounts. I definitely encourage you to read about it if you don't know what it is, but it's just another barrier to preventing any kind of data leak or hacking into any online account you might be using. Now, I just want to hand it off to Mohawk to talk a little bit more about the technology aspect of Next and our history and an exciting projects that we're working on in terms of improving the security of our program.
Hey everybody, my name is Mohawk Green and I'm the technical program manager. So I guess I'll just start with a little bit of background. Do you mind bringing the slides back up? It should have a little diagram for us to sort of navigate. Yeah, so here I have our beautiful diagram. Dan's already kind of walked us through a little bit of what's going on when a participant is enrolling in our system. So on the left, you have someone who's logging in from their computer or whatever device they're using to connect to the internet. And what we had built previously was built a couple of years ago when Next infrastructure was more catered to New York State and wasn't really designed to scale to where we are now. So originally, this setup that we had was allowing people to enroll via a form online. It would encrypt because, as Dan said, we're a stickler about security when we want to make sure that people's information is not accessible to third parties or could be easily sold, by a third party corporation like Google or something. But everything would get encrypted every time that someone would use these forms, and then these forms would then be decrypted on a very special computer that we had. Unfortunately, it only was accessible from one computer, and that computer broke right before COVID. So we had to make some very hasty adjustments in order to continue operating this program. So what we've been working on since then is to make this program accessible to all of our affiliates as well, because like I said, it started kind of with one computer being able to do this accessing of this encrypted data. We want all of our affiliates to be able to use this software. So what we're working on now is basically, instead of using any third-party applications, we're using all of our own servers and databases and building our own desktop app that would allow our affiliates to be able to retrieve all of their enrollment information or order form information. And with that would, give us a lot more control over being able to collect the type of data we need to collect, securing everything we need to secure. And honestly, like the diagram kind of shows everything in the flow. You have your participants filling out whichever form it is. We have a few a few ways of enrolling, or different forms that we have. We have a reversal refill form for people who may have used their naloxone and are ordering more, or it's expired or something has happened to it. They're either enrolling in the Next Distro program or the naloxone program, or they are ordering through, they're ordering supplies like the syringes or cotton swabs and things like that through our program. And all of that stuff is going to be accessible for our affiliates. And if you advance to the next slide. So we've already gotten a lot of our kind of like interface mapped out. These are just some of the mobile-based designs that we have for what an order form would look like for a participant. And this is accessible once someone has enrolled through the Next Distro program. They're into their unique user handle, and then they're able to access ordering supplies securely. And for now, there's a lot of work happening on the back end to make sure everything's secure, that there's quite a low barrier of entry. If for some reason someone disconnects from the internet, we have sessions that allow them to continue being able to fill out the information for enrolling or ordering, only for a limited period of time. Like, if they for some reason walk away from like a public computer for like 30 minutes, their information is still not going to be up there. But we are basically, taking the security aspect of it very seriously. What we're building is actually extremely unique in the concept that it's kind of like one way. Like, there is no like user login system in the traditional sense where we all have logins for like email or social media and things like that. And if you lose your password, you can retrieve your password. None of that stuff is happening here because we really don't want to have information just kind of floating around back and forth between devices that way. So everything is just going one way through an encryption, and then the only people who can access that information again are the affiliates, like Next Distro and the affiliates, and only through the software that we're building specifically to access it. So there'd be no other way for people to access that information, including the clients. If there are any issues with someone needing to, figure out something with an order, something was wrong, something needs to be updated, that's kind of where the manual in-person interaction will have to happen with that, just because we want to keep things from, getting leaked out. And yeah, that's basically it. We're still in a place of working through a lot of the back end of it, but we're projecting that by April we'll have something more visual so people know what it looks like. We have a lot of these static wireframes right now, but the front end is being built, and there will be things to start interacting with by spring and summer. So things are moving along after kind of having lost our original setup for doing this type of encrypted enrollment and order form work. So, I hope that that was like coherent for people who are not super tech savvy. That's all I have.
All right,
Really?
so I think.
Okay, sorry.
Yeah, no, cool. I think I'm up now. So I am Corey Davis. I run the Harm Reduction Legal Project at the Network for Public Health Law, and love the Next Distro folks. And they asked me to just give a little overview of sort of the legality of mailing harm reduction supplies. And so, this is one of those things that's kind of easy to do at the really big picture level, and doable at the level of an individual program, but is kind of difficult to do sort of in the middle. So I'm going to give you kind of the 30,000 foot view, and then happy to talk with folks, after the webinar with your, talk to your particular situation. So, at the federal level, there is a law that says that you can't use the mail to transport drug paraphernalia. And whether syringes are paraphernalia depends on what they're going to be used for. But in any case, there's a big exception to this law. And the law says that it doesn't apply to any person who is authorized by local, state, or federal law to possess paraphernalia or to distribute it. So if you're allowed to give out syringes or have syringes under your state law, then there's no problem with mailing them. The federal law simply doesn't apply. It has this huge carve out. It was never intended to prohibit what states permit. And nobody has ever been arrested under the federal law for mailing syringes. It's just not something that the feds are interested in doing. So most of this is a construct of state law. And states are vastly different in how they regulate syringes that might be used to inject drugs. There are some states where there is clearly no problem. So for example, Alaska has no paraphernalia law. They just never passed one. There are a number of states, well, there's a small number of states that have a paraphernalia law that doesn't criminalize the giving away of paraphernalia. So there's like a random assortment. There's Arkansas, Michigan, Vermont, West Virginia, have laws on the books against selling paraphernalia, but it's not illegal to give it away. So there's no problem there. And then you have a couple of states that have carved out syringes and injecting equipment from their definition of drug paraphernalia. Nevada did this a few years ago. Wisconsin's done it. Oregon has done it. So in states like that, there's no problem. There's no criminal problem mailing syringes because they're just not paraphernalia, in the same way that there's no problem with giving them out in person because they're not paraphernalia. But in most states, it's still the case that in general, giving out syringes that are going to be used to inject illegal drugs or legal drugs illegally, which is kind of what we're assuming with most of NextDistro's work, is prohibited. And then there is a carve out for syringe exchange. This is sort of a bizarre way of doing things where syringes are legal if you get them from one place, and the exact same syringe is illegal if you got it from another place, but that's the system that we have. So when you're looking to see if you can mail syringes, you just have to look at what are the requirements to be an authorized syringe exchange or syringe access point or syringe distributor, however your state says it, under state law. And those are all over the map. So there are some states where it would likely be very difficult to integrate mail-based syringe distribution into the existing syringe access program because there are requirements for what it means to be an SSP that are very difficult to meet through a mail-based system. And I'm thinking here of states like Florida, states like Delaware, where there's a one-for-one exchange requirement. So to get a syringe back, you're supposed to bring a syringe to the exchange. Now, you could imagine situations in which you could do that, integrating mail-based systems, but it would be really difficult. So that's one end of the spectrum. You have other states where the syringe access laws are very broad. Once an organization is authorized by whoever needs to authorize them under state law to be a syringe access point, there are very minimal requirements. They may have to report some broad data to some state agency, but there's nothing that couldn't be done via the mail. And most of these laws are silent on how the syringes are to be delivered. Most of them don't say anything to the effect that a human needs to physically hand off the syringes to another human. So in those states, there shouldn't be any problem with mailing them. If you can give them out, you can mail them. And then there are a bunch of states that are somewhere in the middle. So states may have a requirement, for example, that people who are accessing syringes from the exchange need to be provided with referral information or something like that. Depending on exactly what's required, that's the kind of thing that you could probably integrate into a mail-based program, either by coupling the mail-based program with, access to someone who's on the ground, or even, if it's just a requirement that referral information be provided, you can mail that to somebody. You could mail somebody their supplies and have a phone number that they can call. There are, in a fair number of states, ways that you can meet those requirements without actually having a physical interaction with the person. But this all really, this is all kind of state specific. Every state's law is a little bit different. So like I said, please reach out to us. I'm happy to talk through it with you. I would say, these can be changed. So, Maine, for example, the governor issued an executive order permitting syringes to be mailed due to the COVID crisis, right? I mean, it was difficult for people to come in person, so advocates were able to get the governor to use his executive authority to say, look, this one-for-one requirement doesn't. I mean, so so both things. So Maine has a one-for-one requirement through regulation. So the governor waived that, and also said that they can be mailed. So these things can be changed. That's syringes. Naloxone is a lot clearer. Federal law doesn't say anything in particular about mailing naloxone. And it's common for naloxone to be mailed. A lot of pharmacies, a lot of health plans are moving to mail-based access to prescription medication. So as long as the person is able to provide naloxone under state law, in most states, there's nothing prohibiting them from mailing it. 38 states now permit lay distribution of naloxone. So, someone who is not otherwise authorized to give out naloxone, a community-based organization, harm reduction organization, health department, and so on, can give out naloxone. And those laws tend to be written very broadly. So in general, in those states, if you're able to distribute naloxone, the law doesn't say how you have to do that. So you can, in all likelihood, mail it. One problem there is that a bunch of states now have these statewide standing orders where a state health official has issued a standing order where you can get naloxone at any pharmacy in the state, and some cover other organizations. Sometimes those are more specific and they do require some sort of personal interaction, but those can be changed as well. So for example, a few months ago, Pennsylvania's health commissioner changed their statewide standing order to explicitly permit community organizations to mail naloxone. And that's the kind of thing that it's purely a matter of either state law, state regulation, or in a lot of states, it's just a state official, the director of the health department or somebody like that, who has very broad authority to make that standing order say whatever they want it to say. So it's this kind of bizarre thing where there are, in general, it's easier to mail naloxone and be clearly within the law because we have these really broad naloxone access laws that are designed to get naloxone broadly into the community. Whereas on the other hand, we still have this system that is really designed to make it more difficult for people to get syringes. So that's the 30,000-foot overview. I will stop there and throw it back to Jamie or Laura.
I do just want to mention that Corey and the folks at the Network for Public Health Law helped us create a state-by-state fact sheet about syringe access, paraphernalia, and naloxone, and it can be located at nextdistro.org/policies. And that resource is really for participants to better understand the law in their state. It's written specifically for lay people. So please check out that resource.
Yeah, so thanks so much, everyone. This is really, really exciting and informative. And I could listen to Corey Davis talk about legal spectrums all afternoon. Just so calm in the thing that stresses a lot of us out. it seems that we have a ton of questions, and so I want to, really respect time and make sure that we have space to get to all of them. I'm gonna start us off, I guess, and I'm curious, Jamie or the next team, can you say a little bit more about what partnership looks like and contracting looks like with either state or local health departments in terms of like who plays what kind of role? Because I feel like that's a question that I get a whole lot with our relationship with health departments who are interested in doing this.
I can take that. So the partnerships look very different for the Naloxone program and the full service harm reduction program. For the Naloxone program, we've been doing it for many years. We have 34 state affiliates right now. We have an affiliate policy and procedure manual, and we partner with in-state programs to distribute their own Naloxone under their own standing order in their own state with their own supplies. So that is fairly cut and dry. The full service harm reduction program is a lot more complicated, specific, and it also requires dedicated personnel. The way that the harm reduction program functions is, like Sean and Dan were saying, it's very customized. We send everyone supplies that are to order. We include handwritten notes with all of our requests that go out that are specific to the person. So there's more involved because it requires a bit more capacity building and technical assistance, and also a broad conversation around strategy and scalability in the state. So if partners are if folks are interested in partnering, I would suggest reaching out to us at info@nextdistro.org, and we can talk more about specifics.
Great. Yeah. So and just for a note for our panelists, Alika, who's helping over here on our side, is going to start putting some of the questions that we've received into the chat. So you might want to look at that. And fair warning, Sean, you're probably going to get about 6 emails because people have been asking for that. I'm not going to go over them. So one question that kind of kicked this off is really kind of going back to that idea of whether services, how to connect people, or what would happen if someone did live in an area that did have a harm reduction program, but they still had a reason for trying to order supplies through you all. It feels to me like there's no cut and dry answers to these things, or like hard lines from you, but I'm curious if you could talk a little bit about how you would evaluate that, like if someone is saying that they would still prefer mail-based, even if there's a local resource.
I can jump in and take that if that's all right. So in California, at least, like we're currently trying to develop, or we're currently in process of developing metrics so that it's an equitable sort of process depending on who's processing the enrollment. It also involves a lot of conversations with the individual. Like one reason we would try to push back or explore with the person would be if there's an issue around stigma, if that's like an issue that's preventing access, or lack of knowledge of the local programs. It's as you said, there is no specific at this point like cut and dry like answer I can give about how we would determine that, but it is many factors: accessibility, transportation access, disability, etc. So it's really a complex and individualized process based on the participant.
Great, thanks, Sean. And another kind of question that feels very logistical, thinking about mail and that it costs money. Have you created any like relationships with specific mail carriers, either in the California program or in general, that you know of, that helps with shouldering some of the costs?
Yeah, so we ship via USPS. Love the USPS so much.
Save the USPS.
Yeah, like, such huge fans of the USPS. We use a platform that sells USPS postage at a discounted rate. It's not specific to nonprofits. I believe that like anybody with a sort of like retailer shipping enterprise can use it. So we do receive discounted rates, but it's not like a nonprofit specific fund discount. I don't know, Jamie, if you wanted to add any more to that.
I would just say that the one time, like I've used UPS, and like that's the time when the packages, like there was a problem. I feel like the United States Postal Service delivers to any, any building in the entire country, whether it be, in rural Alaska, they will mail, and we really enjoy supporting the United States Postal Service as an essential national service. So. It's also incredibly much less expensive, and the United States Postal Service has much better privacy and security than UPS or FedEx.
Yeah, that's real. And I loved how you brought up that, for folks who are unstably housed or maybe don't have a permanent address, that like trick that's so old school with the Postal Service is that you can send general delivery to post offices. I just feel like a lot of people don't actually remember that or know that, and it is a great trick for folks who are transient or unstably housed or whatever. So really appreciate the thoughtfulness there. So some questions have come in regarding disposal and sort of supplies that you offer related to disposal, or how you advise people, in terms of proper disposal and or adequate disposal within communities based on their jurisdiction or where they're at.
Sure. So it looks like maybe Jamie was pulling some supplies to share.
I was.
Yeah.
I want to mention a few things. One is that we ask people about how they dispose of their syringes during the enrollment, so we can ensure that we're addressing any type of gaps. In the new client pamphlet that everyone received, there's a lot of information about haz waste disposal, including a hierarchy of risks, like what's the absolute worst place to dispose of your syringes, what's the best, and like what's everything in between, depending on folks' resources. We do not request syringes back through the mail, although we do know of one program that did try to do that. We have several different sharps containers, including a 2-gallon size quart and then a personal sharps container. We also give out syringe clippers. And these are home haz waste devices, and they simply clip off the tip of the needle so the syringe cannot be reused. And the tips of the syringe are kept inside of the cavity of the syringe clipper, and that will clip the tips off of about 1,500 syringes. So these are also great options that we mail out. And yeah, it's just an ongoing conversation that we have with folks also about haz waste.
Cool. Yeah, no, I think that's exactly right. The idea of like the hierarchy of risk, like good, better, best, or please don't, and yeah, some good options there. So it sounds like, yeah, there is a question about laws prohibiting mails use syringes back through USPS, but it sounds like that is a thing that maybe it just is not encouraged, does not happen. So thank you. Oh yeah, there's so many questions here. I'm trying to.
I would also request that if someone is like, I really want this in my state, but like we have to get the syringes back, and like there's some, like I just want to encourage, folks who are concerned about that to reach out to us, because we can also share lessons learned from states where they did require people to mail syringes back, where maybe it wasn't as effective as they wanted. So happy to explore that with any potential partners.
Yeah, great. And obviously, there are a lot of questions in here about connection to the panelists here and to the program in general. So we can facilitate all of that following up after this webinar. So I'm trying to, There's a question here about legality for physicians to connect patients to Next Distro or other harm reduction shipping services. Do you know of any physicians that explicitly like endorse this or refer to your services?
Just off the top of my head, in California, we have received referrals from physicians. I don't know if Corey has any input on if there would be any legal restrictions, or I can't imagine that there would be a legal restriction, but yeah, physicians, there's a group of, there's a handful that definitely refer to us, and that's a connection I'm looking to build in California all the time.
Yeah, I gotta find the good doctors. So it sounds like one of our partners and friends in California is wondering if you all are open to being connected to a network of mutual aid groups that have been starting to partner more seriously with harm reduction, more commonly with harm reduction programs. And it sounds like the question is whether you would be open to that and if Next would be a good resource for you all.
Yeah, reach on out. Let's explore various collaborations. I am super open to mutual aid organizations and groups. So my email is shaun@nextdistro.org. I can also drop it in the chat. Whoever you are in California, please message me. I'm here. We can talk.
We have a question a little bit, Sean, for your program about referrals. What are the most common kinds of referrals that you get requested to make? And there's a question of whether you have a physical storefront in Oakland, or
Yes.
maybe that's a broader question too for the nation. Like, is that common to have a more physical storefront?
Yeah, so we have a physical space, but we don't see participants in our physical space because we only do mail-based services. So that's not really like advertised as like, hey, come by the Next office or anything like that, just because we are mail-based. The first part of your question is about referrals. I would say, I mean, the most common referral that we make is to in-person syringe exchange programs. Like that's by far the most common referral that's made is folks are not aware that there's a program in their area, or there's been a rumor that the program has shut down and it hasn't, or things like that. And then folks are really able to receive many services through the in-person syringe exchange program. Beyond that, I would say it's common to be asked for mental health services as well as testing services.
Mm-hmm. Great.
Yeah.
I'm wondering, Sean, statewide, how do you sort of a follow-up to that? Like, how do you gather that referral list that feels like a huge task? Like, how do you say, for example, like, you know, try to connect someone with, say, like, housing services in a specific county that is not known to you?
Yeah, absolutely. So I think that one piece of technology that's going to help us with this moving forward in the future will be our web tool, which will have like a case management aspect like built into it for tracking those sorts of things, is like my understanding of, and because currently I just have my own system of keeping track of things. It's not integrated into our like client database. So that's like one thing that'll help us in tracking things over time. I have a lot of connections statewide. I feel really familiar with a lot of different places in the state. We have different, groups, like there's like the California Syringe Exchange Programs group, which is really supportive statewide. If there's someone asking for services in a certain area, maybe there's an SSP in their county, but it's an hour away from them, I would reach out to the SSP and ask for county specific resources for the person who can't access the SSP but could access other county resources. It's a lot of balancing various administrative tasks with also like performing like case management on a statewide level. I don't have a perfect answer for it yet. It's sort of just something we figure out as we go and try to find the best solution for each individual participant, and just like give a really individualized experience to that person, and also communicate our limitations, I think is really important as well. Like some folks feel very comfortable with us and familiar with us, and want like a sort of level of like case management support that we're not really set up to provide. So just like clearly communicating those limitations ahead of time, I think is important part of that process as well.
Mhm. I mean, I love technology, and when it comes to case management, I don't know if Mohawk, you have anything to add to that, or just that's the next webinar.
No, I mean, I basically do want to acknowledge that there will be, I meant to cover a little bit of this, but there will be some features that we currently don't have right now, with kind of just using a bunch of spreadsheets and other like manual and different things kind of like cobbled together. You know, we'll definitely have a lot more access to analysis tools because we can build them. Basically, we can build whatever we want. And so if we're seeing that there's a need that's not being met, we can add it to, you know, add it to our interface that we have for affiliates. And there definitely will be like sort of a profile, like a client profile that we'll have available in the desktop app that'll allow people to make notes on the client, you know, to kind of like take notice of any patterns or anything like that, get them into referral programs and things of that nature. So I did want to expand a little bit on that.
I do also think the questions that came up for Sean around case management and resources drive home the importance of resourcing mail-based distribution as a holistic service that focuses on the needs of the people as they define them. And that takes a lot of people power, especially since we operate on a statewide model. We're really great at communicating and pulling resources, but it does take effort and people time, and that takes money. And I just want to acknowledge that it, like, we don't want people just like mailing supplies and like, here's your box of supplies. Like, no, like we're never going to talk again. It's really about developing relationships like you would at any other harm reduction program. And also, you know, some like the ability, like the type of services you could offer really depend on the amount of infrastructure you're able to give to the mail-based program or the syringe exchange program in general. Perhaps that involves like a telehealth-based nurse to support people, or case manager, or you know, case coordinator. So just want to mention that.
Cool. Yeah, and that feels like another interesting and innovative way that, like, I'll just say like health departments or public health systems could be creative about expanding what, like building on and working with you to build on what potential services could be offered. Because it's, yeah, we all know funding supplies for them is hard, and funding staff is often easier. So that's great. So we have gotten a couple questions about if you all have considered in the future sending any HIV or hepatitis C self-tests like OraQuicks and stuff.
Yes, Sean and I were just talking about that this morning. And we do have, like, in Pennsylvania, you know, we have that, the state offers that option. There are some states that offer mail-based HIV tests, but they're not, the state isn't prioritizing the injection drug using population. So we have a lot of advocacy to do at the state level to ensure that health departments are prioritizing people who inject drugs for those resources. We do also connect, we have a connection with a private company that does it, but it does cost money. So that's a limitation there.
I'm just trying to get through to some real gems here. Oh, okay. So Mohawk and Corey spoke about security and legal concerns. Are you more fearful of HIPAA type security with medical and privacy concerns? Or are you more fearful of legal or police interference? Is a security concern from the client perspective? Does that make sense?
Do you want to take that first, Corey, or I can speak? So yeah, it's mostly that we want to make sure that the client's data is protected. A lot of people who use technology don't actually understand how insecure some of their stuff is. So we are, you know, basically taking extra steps to ensure that, you know, they don't make themselves vulnerable. Where there's like all over our website, we even have like a whole page, I believe, like a infographic that explains exactly how things like Signal works, how to make it extremely secure. So everything around our technology is, you know, part of it's like an educational process of like, we're protecting you, even if you're not really aware of it. You know, we want to make sure that all of the information that's on our servers, you know, if for any reason someone wanted to have access to information around a client's name, you know, like if like say for instance they were like they, what do you call it when they try to collect your data for like legal reasons, like subpoena the information or whatever. So like even if someone accessed our database, it's all encrypted. So like they can't see anybody's personal identifying information. And even with our first iteration of that using Google Spreadsheets, in the Google Spreadsheet, it was encrypted. Like nowhere was it like plain text readable, human readable, even when we're using, you know, third-party applications to move information around. So that's essentially the same process we're doing to protect the client. We're not super concerned about like hackers or something, you know, we're like a little community-based program, like shipping around harm reduction supplies. Like hackers aren't necessarily interested in that type of information. I mean, they could get to it, I guess, if they really wanted to, but again, it's secure. It's more or less about protecting them from like any legal ramifications if somehow their name or an address or something that's identifiable to them, or you know, someone were to catch wind of that and try to like subpoena that information, and you know, maybe they have a warrant out or something, anything like that. We're just trying to keep that data from being leaked.
Yeah, I would just say, I mean, it is, you know, obviously keeping the data secure and private is important for a number of reasons. My guess is that Next is actually not a HIPAA covered entity, but I mean, our concerns are always, I mean, my concerns are always about the criminal aspect. You know, we don't want to inadvertently, you know, make it easier for people to get, you know, caught up with law enforcement because they're trying to keep themselves safe. So when I think of the data privacy, I'm more thinking of it from that standpoint. And as you've seen here, I mean, they Next has put a lot of thought into that.
Yeah. No, and that's, I mean, it speaks to your reach and the trust that you built, even in a male-based community, and that is real. I recognize that we are coming to the end of this planned session. Just as a note that we have gotten a couple different questions, or well, we've gotten a lot of applause from a lot of people, which is great, and some real accolades from partners in different jurisdictions, Hawaii in particular, as well as Colorado. So really great. Some of the questions that have come in are kind of about connecting some jurisdictions like DC and other places that have trying to start their own sort of mail-based naloxone, or they're building out that right now. And I guess it's a question about like, how is there a good way for them to keep in touch with you all, so that if you get requests from those jurisdictions, that like you can then contact the health department or share sort of that access, or that the resource that already exists. And I think it also just speaks to general, like, what are the best ways to kind of keep in touch with you all with general questions, ongoing questions, and potential collaborations and connections in the future.
Dan, do you want to take the naloxone one?
Sure, yeah. So we absolutely welcome anyone who's building their own program and is responsive to their community's needs. Just recently, we were talking to Jefferson County Health Department in Alabama, and they now have a program that we're going to be highlighting on our website soon, so that people within Jefferson County can request Narcan nasal spray and have it sent to them through our website. So it's using their infrastructure rather than ours. A good way to do that, it was on the slide, just info@nextdistro.org is a good place to reach out to us. We'll see all those emails if you want to stay in touch that way. But we love hosting resources on our website that, you know, are useful for different folks in different states and different regions of states.
Yeah, just a quick plug too. If you have resources, if you're on our site and you're wondering why you're not listed, if you have a state-specific resource, or you think there's a way we could improve, this project is always trying to strive to be better than it is and improve. And we're really excited about any community feedback. We're also on all social media at nextdistro.org, and on the bottom of the website is a newsletter. We have a quarterly newsletter if folks want to keep up with us that way.
Mhm.
Yeah, and I would say folks can always email me. I'm happy to answer, you know, questions specific to your program or to your state, talk you through, you know, your state laws, and you know, make sure that you are you're doing everything by the book.
Yeah, a lot of support across the board here in this community. So I really very much appreciate that. Okay, so any final parting thoughts or hopes that you all have as panelists, things you'd like to share before we sign off? And
I just want to thank everyone for coming today and listening to us talk about this project that's been so impactful to so many folks. So that's my thank you.
Tell all your friends about Next. Also, we have a TikTok. Jamie is awesome. She says no.
cool. All right, well, you all are getting an incredible number of appreciations for sharing this amazing work and for creating this amazing work and being very thoughtful about it. And so I'll just end where I started, that you know, that is resoundingly, you know, coming from my house over here too. Always really appreciate your work and your creativity and your innovation and your care. So without further ado, we'll follow up with any questions, and really just appreciate everyone taking the time today. I know that this has been really thought-provoking for a lot of folks. So yeah, just appreciating you, and I hope everyone has a great day. Okay.